Basal insulin is the insulin that you give yourself as the baseline, as the insulin that's necessary for your 24-hour period without taking into account whether you eat or not eat. That is the insulin that's called the basal. The bolus is an immediate, sudden injection of insulin that will cover only an acute rise in glucose, something that happens after you eat. The sugar will go up and you need to cover for that. So the sugar will keep going up if you don't have any other insulin. So the bolus is going to be an insulin that covers the elevation of the sugar after a meal. And that can only be given if you eat a meal. If you don't eat a meal, you don't need a bolus. This is the general rule. People use the term prandial insulin to refer to the bolus insulin that's given in the Basal-Bolus program that most patients with diabetes type 1 and some patients with type 2 are using to treat their diabetes. So the Basal-Bolus regimen, the type of treatment, insulin replacement, covers the basal insulin and the bolus, which is also called the prandial insulin. When you inject yourself with insulin as part of your treatment with the basal and the bolus that we discussed earlier. Okay, basal insulin is the one that you need 24 hours a day. It takes care of your baseline, the needs for energy source to be stored and utilized. They are independent of the meals. The bolus insulin obviously is necessary only before you eat a meal. Now let's go and explain to you what is a bolus type of insulin. This is an insulin, regular for example, is an insulin that has the ability to get into the circulation after an injection in the subcutaneous tissue under the skin in about 2 hours. And it comes out in about 6, maybe to 12 hours. It has a big peak and a clearance of the circulation clearance, that goes away in about 6 to 12 hours. So it's a rather rapid acting insulin, but not very efficient because it comes in 2 hours and it leaves the system in 6 to 12 hours. So it's like covering the meal, but has a little bit of a tail effect, if you know what I mean. I mean, it stays around more than it should, and it's not perfect. But we've used it for many years, and it's still used by some patients, okay? So if you're taking regular, the most important thing to remember is that you need to have something to eat after you inject regular insulin. That is one type of bolus, short-acting insulin.